There are misconceptions when it comes to the issue of dietary advice for patients with chronic kidney disease. The first misconception is that plant-based proteins are incomplete proteins. This is just an opinion. It is what we assumed, what medical professionals had assumed. However, we now have more information. There is a research that studied over 1,000 chronic kidney disease patients. They were divided into two groups. Group 1 consisted of people who eat regular food. The other group are what we call vegetarians. Both groups were followed for 8 years. It was found that the vegetarian group had fewer number of deaths compared to the group that consumed animal-based proteins. So, it is recommended to consume proteins from plants, nuts, sesame, brown rice, etc. The second misconception is that potassium is harmful for kidney disease patients. Potassium is naturally found in plants, vegetables, and fruits. The notion that potassium is harmful for kidney disease patients is an old belief. In the old days, by the time we diagnosed patients, they had already reached end stage, and we did not have dialysis then. So, avoiding potassium intake through food was vital. That is, the basis of the advice that chronic kidney disease patients should avoid potassium-containing food, or in other words, avoid eating plants, vegetables, and fruits. However, nowadays we have method to screen for kidney disease. Kidney disease can be categorized into 5 stages, namely 1, 2, 3, 4, and 5. Stage 5 patients who display hyperkalemia will simply undergo dialysis. Very few now become critically ill due to potassium dysregulation, but most chronic kidney patients are not at that stage. They have intermediate stage chronic kidney disease. These people will benefit from eating plants, vegetables, and fruits. The third misconception has to do with our own medical profession. We are concerned about hyperphosphatemia. However, there is a very nice research study that studied 2 groups of subjects. One group consumed proteins from animal only. The other group consumed soy-based proteins only. After a period of time, the researcher performed a crossover and kept on following their subjects. They performed a blood test to check serum phosphate and phosphorus levels. They found that the subjects had high level of phosphorus or phosphate during the time they consumed animal-based diet. When switched to plant-based diet consisting of nuts and sesame, phosphorus levels in turn became lower. This clearly concludes that soy proteins do not cause hyperphosphatemia in kidney patients. Another issue I want to raise has to do with another old notion that people with gout absolutely should not eat nuts because of the high uric acid that can lead to gout flare. This is a long-held notion among medical professionals, but we now have an evidence, a very good evidence. The study looked at over 100 gout patients. One group followed a traditional diet of meat, milk, egg, chicken, and fish. Reduce intake of whatever food has high purine content. The other group followed a vegetarian diet. This contained only soy-based proteins in the absence of any meat. The meal plan was chosen randomly, regardless of the subject's diet preference prior to the study. The results showed that the group that consumed meat, milk, egg, chicken, and fish had more gout symptoms, whereas the vegetarian group experienced less symptoms of gout. This study thus provides clinical evidence in human, which is a high level of evidence and is considered a very good evidence. That the notion that gout patients should not consume nuts because it will lead to a joint pain is false. Instead, it is the animal-based diet that causes more gout symptoms. Accordingly, these 4 issues above are misconceptions, which refer to incorrect notions about chronic kidney disease.
Mega, we care.